Good morning. Okay,
Yes,
fine.
sir.
We will start with the topic today, that is stroke or cerebrovascular accident. Okay, CVA stands for cerebrovascular accident. It's called stroke. So rather than CVA, we'll refer to it as stroke. Okay. So first, what's the definition of stroke? We'll start with the definition of stroke, right? So stroke is a syndrome. Syndrome is a collection of features. It's not a single feature. So with four different features, right? Four key features. What are they? Number one, it is having a sudden onset. Number two, focal involvement of the central nervous system. Number three, it characterized by lack of rapid resolution. And number four, it is having a vascular cause. So what is stroke? Stroke is a syndrome with four features: sudden onset, focal involvement of the central nervous system, lack of rapid resolution, and vascular cause. Sudden onset means it starts like a bolt out of the blue. The patient is totally all right, and then suddenly the patient suffers from a stroke. So it is sudden onset. It is not that the patient is sick. It is like a bolt from the blue, like a lightning. Suddenly it will start. The involvement is the central nervous system. It is involving the brain mostly and sometimes the spinal cord, but mostly it involves the brain. Brain is a part of the central nervous system. And there is focal involvement. Focal means it does not involve the whole of the brain, a part of the brain is involved. So a focus is there. It doesn't involve the total brain, it involves a part of the brain. There is lack of rapid resolution. It stays for a long time. The deficits or the problem, the symptoms due to stroke, they last long duration, maybe lifelong also. So they do not get resolved very fast. And its cause is a vascular cause. It is because of disease of the brain blood vessels. So this is very important to remember each and every line or features of stroke, that it is a sudden onset like a bolt from the blue. It is having a focal involvement of the central nervous system, that is involving the brain mostly, sometimes spinal cord, but mostly the brain. And it is focal involvement, that means it involves part of the brain, the whole brain is not involved. Number three is lack of rapid resolution. That means it is lifelong mostly, the symptoms, and it does not 100% resolve. It does not become okay. And it has a vascular cause. The reason of this problem or this involvement of the brain is because of the blood vessel of the brain. It is not because of any other cause. The cause is vascular. Vascular means blood vessels, and blood vessels means arteries, veins, or capillaries, mostly arteries, arterial stroke. We classify the stroke into two major headings. They are subclassified again, but majorly two big headings are there of stroke. The major heading side is ischemic stroke or a hemorrhagic stroke. We'll go into detail. Remember, ischemic stroke is again divided into large artery, small artery, cardioembolic, lacunar, and unknown. Hemorrhagic is bleeding. It is divided into intracerebral and subarachnoid hemorrhage. We'll go into detail of each of them, but remember the major classification of stroke is ischemic stroke and hemorrhagic stroke. Ischemic stroke is more common. 80% of all the strokes are ischemic strokes, and 20% is hemorrhagic stroke, right? Ischemic strokes are more common. Now we'll start with the first type of stroke, major category, that is ischemic stroke. What does it mean? In ischemic strokes, there is occlusion of a blood vessel that interrupts the blood flow of the brain in a specific region. So the disease of stroke is vascular, so something is wrong with the blood vessel. In ischemic stroke, what happens? The blood vessel is blocked. Like a pipe getting blocked, the blood vessel is blocked. So there is occlusion of the blood vessel. And not all the blood vessels of the brain, some blood vessels in the brain is blocked, and that causes the interruption of blood to not the whole brain, but a certain area of the brain. So it is focal. It is not generalized. It is focal region of the brain is occluded of his blood supply, and the blood supply is interrupted because the blood vessel is blocked. It is occluded. What happens when the blood vessel is occluded to that part of the brain? The blood supply to the brain is stopped. And because of the blood supply is stopped, the oxygen and the glucose that the blood is carrying to the brain is also stopped. So the brain is deprived of the glucose and the oxygen. What is important in glucose and oxygen? They are the nutrients of the brain cell. So the brain is not getting its nutrition. So the glucose is also not going to the brain cells, and oxygen is also not going. So the brain is not getting its nutrition. What will happen when the cell does not get its nutrition, the cell is going to die. So the cells in the brain parenchyma and the tissue die. How do they die? By cellular necrosis or a process called apoptosis. This death of the brain tissue leads to infarction or ischemic stroke. Okay? So what happens in ischemic stroke? In ischemia means they are deprived of blood supply. They are hungry for blood, but the blood is not reaching. Why the blood is not reaching that part of the brain? Because the blood vessel or the artery is blocked. How it is blocked, we will study. Because of the blood supply is not going and the artery is blocked, what will happen? The brain will not get its nutrition. What nutrition will it not get? Glucose and oxygen, which is carried by the blood, and the blood is blocked. Because the brain is not getting its nutrition of glucose and oxygen, what will happen to the brain cells? The brain cells will die. How do they die? They die by cellular necrosis or apoptosis. There are two methods of pathological changes that occurs in the brain cells when they do not get the nutrition. And because those brain cells are dead, it leads to what? Infarction or ischemic stroke. So that area of the brain cell is dead. Now, the pathophysiology of ischemic stroke. Why does the blood vessel become blocked? Why does the blood vessel become occluded? Two mechanisms of ischemic strokes are there. The blood vessel becomes occluded by two pathophysiologic mechanisms. One is thrombosis and the other is embolism. Thrombosis means what? The occlusion of the arteries takes place by a mechanism called atherosclerosis. Atherosclerosis is a subject of study, but the whole mechanism is not completely understood. So what happens in atherosclerosis? In atherosclerosis, the blood vessel becomes blocked. Right? How does it become blocked? If you consider this to be the wall of the blood vessel, okay, this is the wall of the blood vessel made up of 3 layers. Inside the blood vessel, there is the blood flowing, right? And there is the endothelium, that is the innermost layer of the blood vessel. So what happens? This endothelium or the innermost layer, sometimes they get injured. They get injured by high blood pressure because the blood is flowing very fast. They get injured by other materials, other means also. Sometimes there is inflammation of this endothelial layer of the blood vessel, so it becomes rough. So what happens when it becomes rough? There is collection of cells, there is collection of material, fatty material in this part of the endothelium, under the endothelium. Fatty material consisting of cholesterol, consisting of lipids. These lipids, they collect inside the blood vessel and the blood vessel becomes thickened. And after the lipids collect, there are platelets which gets coagulated on the blood vessel because it becomes irregular. And then what happens? The blood vessel becomes small and becomes occluded. Okay? The lumen becomes occluded. How does the lumen become occluded? The lumen becomes occluded in the blood vessel because collection of material takes place. What materials collect in the blood vessel? Lipids, cholesterol, and platelets. These they collect inside the blood vessel and block the blood vessel so that the blood doesn't flow. So ultimately what will happen? A blood vessel lumen becomes very small. Instead of the big lumen, what will happen? All the platelets and all the cholesterol has collected inside the blood vessel and leaving aside a small hole for the blood to pass. And sometimes even this becomes totally blocked and the blood cannot pass to the blood vessel. And therefore, the blood vessel becomes occluded. How does it become occluded? By the process called atherosclerosis. What happens in the process called atherosclerosis? In the process atherosclerosis, there is collection of lipids, collection of platelets in the innermost layer of the blood vessel and thereby occluding the lumen. What is the lumen? The lumen is the hole. The lumen is the passage of the blood vessel. So when that lumen or the passage is full of platelets and full of fat, then the blood cannot pass and therefore there is occlusion. And this occlusion causes ischemic stroke. So the lumen becomes small and further collection of that material of fats, lipids, cholesterol and platelets will decrease this passage of the lumen until it is sometimes totally or 100% blocked. Second type of pathophysiology of blocking of the blood vessel is called embolism. In embolism, what happens? The cerebral arteries or the arteries of the brain are blocked or occluded by the distal passage of a clot from other place like the heart, aorta or other arteries. Here what happens? The blood vessels of the brain are blocked. How they are blocked? They are blocked by something of a clot. And this clot does not come from the blood vessel, but it comes from some other place like the heart. So it comes and blocks the blood vessel. So there is some material inside the heart, lipids and platelets. They come from the heart and they go into the blood vessel inside the brain and they block the blood vessel. After the blood vessel becomes blocked, why do they block the blood vessels in the brain? Because the blood vessels in the brain are very small lumen. They are not very big arteries like that in the other parts of the body. These are big arteries in the aorta, the carotid, all these are big arteries, so they do not get blocked by the small material coming from the heart. But this passes on and goes very nicely by the bloodstream, and once they reach the small arteries in the brain, they block the artery. Because the brain arteries are smaller in caliber. And once it gets blocked, what will happen? The blood flow will not be there, glucose, oxygen will not be there, and the tissue dies. Once the tissue dies in this place, it causes infarction, leading to ischemic stroke. So in thrombosis, what happens? The artery inside the brain is getting blocked by the material that is deposited. In embolism, the blood clot or the clot is coming not from the artery inside the brain, but from a faraway organ like the heart. And from the heart, because of the rapid beating of the heart, it can get dislodged and they come into the blood vessel. Because the other blood vessels are big, they can pass through it easily, but the brain blood vessels are small, so they get stuck. Once they get stuck, they block the blood, they occlude the vessel and lead to stroke. So this is again explaining both the mechanism of ischemic stroke. What happens in this? In the thrombosis, the blood vessel inside the brain is getting blocked, reducing the lumen of the blood vessel or the passage by fat, lipids, cholesterol, and platelets. All these are inside the blood vessel, and the flow is blocked. In the case of thrombosis, in the case of embolism, the blood vessel is okay, there is no problem here, but something from the heart, the clot from the heart, because of the fast beating of the heart, because of irregular rhythm, can come, and because the brain vessels are small, it will stuck out here, it will get stuck and then cause occlusion of the blood and leading to stroke. So the material comes not from the blood vessel but from a faraway organ like the heart. So that is called embolism. Embolism means movement from one part of the organ to another part, and thrombosis means in that part only the pathology is there. Right? But in both the cases, the brain blood vessel becomes blocked. In one case, in thrombosis, it becomes blocked because of the deposition at that place. And in embolism, it becomes blocked because of the transport of the clot from the heart through the other blood vessels into the brain. And because the brain blood vessels is small, it cannot pass, and this clot blocks the blood vessel. That clot can present in the heart. So in both the cases, there will be blocking of the blood supply. And the blood supply gets blocked. Again, we said no glucose, no oxygen, and the cells die. What are the causes of ischemic stroke? The most important cause of ischemic stroke is hypertension. But otherwise, age, older the age, the more chances of ischemic stroke. Why? Because the arteries, they become hard with age. Some genetic predisposition is also there. Then the most important cause, however, is hypertension. Uncontrolled hypertension from a long time, high blood pressure for a long time is a major cause of ischemic stroke. That will cause what? That will cause the damage of the blood vessels, leading to more collection of fat and platelets inside the blood vessel because of the hypertension. Diabetes can cause stroke. Smoking, dyslipidemia, that means excess cholesterol, excess lipids, high cholesterol, high amounts of lipids can cause stroke by blocking the blood vessel. Alcohol can cause stroke. Cardiac diseases can cause embolic stroke because of disease of the cardiac valve, myocardial infarction, and atrial fibrillation. Atrial fibrillation means irregular beating of the heart. So blood clot can form in the heart, and that clot can get dislodged and go inside the brain blood vessels to cause blocking of the blood vessel and stroke. So that is the embolic stroke. Atrial fibrillation means irregular beating of the heart. A clot inside the heart can get dislodged by this irregular beating. So these are the major causes of stroke: hypertension, diabetes, smoking, high lipids, high cholesterol, that is called dyslipidemia, regular alcohol intake, and cardiac diseases like any valve heart disease or myocardial infarction or irregular fast beating of the heart, that is atrial fibrillation. These things can cause ischemic stroke. What are the clinical features of ischemic stroke? When the blood supply of the brain is blocked, not the whole brain, but a focal or a part of the brain, and that area of the brain tissue dies, then it will cause clinical features of ischemic stroke. What are the features? Most important is hemiplegia. It can cause paralysis of one side of the body. Hemi means one. So half of the body is paralyzed. So unilateral weakness or paralysis, hemiplegia. It can cause paralysis of the face, facial drooping. It can cause dysarthria, that means slurring of the speech, loss of memory, vertigo or giddiness, and loss of vision or visual impairment. Very important, all these features will occur very rapidly because stroke occurs suddenly. It will not occur slowly. Suddenly, within a few seconds, it is going to start like a bolt from the blue. The patient is totally all right, and suddenly they will have paralysis, facial palsy, slurring of speech, and loss of memory, vertigo, or visual impairment. And that is why it is called stroke, because it is like a bolt from the blue, very sudden. Number two, the cause of all this is because of vascular problem, the blocking of a blood vessel to the brain. Number three, the improvement is not going to be there. This patients will take a long time to improve, and sometimes it may not improve also, right? So these are the clinical features of ischemic stroke. Hemiplegia or unilateral weakness, paralysis on one side of the body, facial palsy, dysarthria or the slurring of speech, loss of memory, vertigo, and vision impairment, all occurring very suddenly because of blocking of the blood vessels and very unlikely to improve immediately. It is persistent. How do you manage the ischemic stroke? Number one, you have to maintain the airway, breathing, and circulation, like all emergency patients. This is the emergency because it happens suddenly. We have to dissolve the blocking. A blood vessel is blocked, we have to remove that block. And once the block is removed, then the blood will flow again. But we have to remove the block very fast. If it is not moved fastly, then the damage is permanent. So how to remove the block? The removing of the block can be done with certain medications like tissue plasminogen activator, RTPA. Tissue plasminogen activator is a medication that is given intravenously, and it can go inside and dissolve the blocking, dissolve the clot, and the blood flow will start. But it has to be done within 3 hours of the stroke. If it is done late, then it is no use because the damage is permanent. Then we have to give medicines to prevent further formation of any more clots in that place. We have to give antiplatelet drugs like aspirin and clopidogrel lifelong. We have to control the causes of stroke, like we have to control blood pressure, control diabetes, decrease cholesterol, and stop alcohol and stop smoking. We have to treat any underlying cardiac disease like myocardial infarction or valvular heart disease or atrial fibrillation for embolic stroke. And then the patient has to undergo rehabilitation therapy like physiotherapy for hemiplegia and speech therapy for dysarthria or slurring of speech. Second type of stroke is what? A hemorrhagic stroke. Now this picture will tell you is a cross section of the brain. Hemorrhage means bleeding. So there is a bleeding inside the brain. This is a big blood clot. It is collected inside the brain. So here there is no blocking of the blood vessel, but there is rupture of the blood vessel. The blood vessels burst inside the brain, and then the blood comes out and the blood collects inside the brain. So it is called a hemorrhagic stroke, big blood clot collecting inside the brain. So intracerebral hemorrhage means bleeding inside the brain parenchyma. The cause of hemorrhagic stroke is because of rupture of the arteries inside the brain. The artery inside the brain burst, and because it bursts, the blood comes out and collects in the brain. What happens when the blood collects in the brain? It compresses the brain tissue because the blood is giving pressure to the brain tissue, and this compression can cause destruction of the brain tissue, and it will lead to hemorrhagic stroke features. Okay, so in hemorrhage there is no blocking, but there is bleeding inside the brain. Here the blood vessels are not blocked, but the blood vessel has ruptured. Why the blood vessel has ruptured? What are the causes of hemorrhagic stroke? Because of uncontrolled hypertension. Again, hypertension is a cause of both ischemic stroke as well as hemorrhagic stroke. Sometimes because of alcohol. Okay, sometimes because of head injury. The rupture can occur because of head trauma. Then rupture of the brain aneurysm. Aneurysm is what? Aneurysm is a balloon-like outgrowth in the blood vessel. The blood vessel is usually linear, it's straight. But sometimes what happens, because of some genetic problem, the blood vessel is not regular, but it is having a balloon-like outgrowth. And that outgrowth or balloon-like outgrowth of the blood vessel can rupture and cause bleeding. And sometimes the bleeding can occur because of drugs, like anticoagulant drugs. The drugs, they cause excess effect and cause bleeding inside the brain. They are anticoagulant drugs, right? Anticoagulant drugs can cause bleeding. Not only in the brain, they can cause bleeding in other parts of the body also. They can cause epistaxis, they can cause vomiting, hematemesis with blood, okay? And sometimes they can cause bleeding inside the brain if the dose is excessive. So this is another cause of hemorrhagic stroke. What are the clinical features of hemorrhagic stroke? Hemorrhagic stroke, we have to remember, is very, very dangerous and fatal. It is more severe than ischemic stroke. Okay, hemorrhagic stroke has more mortality. The patient has more chances of dying after a hemorrhagic stroke than ischemic stroke. It is very, very severe. There is headache because of the increased pressure in the brain. There is vomiting. The patient can have a seizure. They can have, again, hemiplegia or paralysis of one side of the body and dysarthria or slurring of speech. And hemorrhagic stroke is very, very severe, leading to death also. So these are the features of hemorrhagic stroke. Because the whole brain is under severe pressure due to this collection of blood, they can have headache and vomiting. They can have epileptic seizures also, and hemiplegia and dysarthria, like we already mentioned in ischemic stroke. And very important to remember is that they are very severe and they can have instant death also. So hemorrhagic stroke is more dangerous and more fatal than ischemic strokes. How do you manage the hemorrhagic stroke? Again, hemorrhagic stroke is a medical emergency because it happens like a bolt from the blue and it is sudden. The patient will come suddenly with all these features, and then, like all emergency patients, you have to maintain the ABC, airway, breathing, circulation. Number one is the medical management. Number two, surgical management. In the medical management, you have to control the blood pressure so that the bleeding doesn't occur more. You have to reduce the intracranial pressure by giving drugs like mannitol. And you have to stop any anticoagulant medications which are causing the bleeding. Stop those medications so that this bleeding stops. And surgical management is the neurosurgeon has to open the skull by craniotomy and remove the blood clot by surgical means. The blood clot that is there, they have to open the skull by craniotomy, then approach this and suck out the blood and remove this blood clot inside the brain surgically, right? So that is the surgical removal of the blood clot. So this was about hemorrhagic stroke. So I will go over it again, stressing on the main points in CVA, right? So basically we call it stroke. CVA was an old term, cerebrovascular accident. Nowadays it's called stroke. So it's always better to use the standard term stroke rather than CVA. So we have to remember the definitions in all cases. Stroke is when a syndrome of four features, when it happens suddenly, when there is focal involvement of the central nervous system, that means brain and spinal cord, but we are talking mostly of the brain, spinal hardly any, but mostly in the brain stroke is there. And focal involvement means involves only part of the brain, not the whole brain. There's lack of rapid resolution. The symptoms will persist lifelong mostly, and it will not become okay suddenly or even slowly. It takes time, and sometimes lifelong the symptoms are going to be there. And vascular cause, it occurs because of vessels problem, either it is blocking of the vessel or rupture of the vessel. So sudden onset, focal involvement of the brain, lack of rapid resolution, and vascular cause. When these are there, we call it a stroke. So a person comes with hemiplegia, we have to ask, when did it happen? If it happens suddenly, okay. Then focal involvement of the brain, we have to see in the CT scan. Then lack of rapid resolution, it will continue, and we have to see the cause whether it is vascular or not. If these are there, then it is a stroke. So sudden onset of focal involvement of the brain, which has lack of rapid resolution continuing for lifetime or long duration, and vascular cause is there, then we call it a stroke. Vascular cause, we have to see from the CT scan. Okay. Classification of stroke is ischemic stroke and hemorrhagic stroke. These are the main categories of stroke. Ischemic stroke is further divided into large artery, small artery, cardioembolic, lacunar, and unknown. We don't have to go into detail, but you have to remember that two main classifications of ischemic, where there is blocking, and hemorrhagic, where there is rupture or bursting. So in ischemic stroke, we discussed that there is occlusion of the blood vessel. The occlusion occurs because of a process called atherosclerosis. And because of this occlusion, the nutrients of the brain, that is the glucose and oxygen, will not be going. And because the brain cells are not getting glucose and oxygen, they will die and will by cellular necrosis or apoptosis. These are the two pathologic processes of death of the cellular cell, of the brain cells. And this dead tissue will lead to infarction. They will not function. They are totally dead. And that is called ischemic stroke. That will lead to ischemic stroke, the death of the brain tissue because of occlusion of a blood vessel due to the non-availability of glucose and oxygen. Right? Now, how do the brain vessels become occluded? They become occluded by thrombosis and embolism. Thrombosis is when in that place there is collection of material inside the blood vessel by the process called atherosclerosis. What happens in atherosclerosis? What collection occurs inside the blood vessel? Inside the blood vessels, lipids collect, platelets collect, and block the blood vessel by the process of atherosclerosis, right? Because of the uneven nature of the endothelium of the blood vessel, of which there are many causes. So because of the collection of the excess lipids out there and platelets, the blood vessel passage or the lumen becomes very small, and sometimes it is totally blocked, and that occlusion causes ischemic stroke of that part of the brain, a focal part of the brain. So the other process is embolism, where the blockage is not because of collection at that place, but because of a transportation of a blood clot from a distant place like the heart. So what happens? The clot is present in the heart, and when the heart is having some problem, like it is beating faster and irregularly, that blood clot becomes dislodged, and that clot can easily pass to the big blood vessels of the other parts of the body, but it cannot pass through the small blood vessels of the brain, and it gets blocked. And once it blocks it, then ischemic stroke takes place because blood is not going to flow and oxygen and the glucose is not going to be available. So this is embolism. The clot is not there inside the blood vessel of the brain, but it is in the heart. And when the heart starts beating faster and irregularly, like in atrial fibrillation, this clot is dislodged. It can easily pass through the big vessels, but once it comes to the small vessel of the brain, it gets stuck and it blocks it, and that is called ischemic stroke by embolism. So thrombosis is when the collection of material takes place at that place inside the brain by platelets and lipids and cholesterol and blocking the blood vessel. And embolism is when the material of the clot comes from the heart because of irregular beating of the heart and goes and blocks the blood vessel inside the brain because of its small diameter. So what are the etiology of the risk factors? Very important is hypertension, blood pressure, high blood pressure, long duration, diabetes, smoking, lipid disorders like dyslipidemia, where there is high cholesterol, high triglycerides, high LDL cholesterol, alcohol, cardiac diseases like cardiac valve disease, myocardial infarction, and atrial fibrillation or irregular beating of the heart, when it can cause a clot to dislodge from the heart and go to the brain by embolism. Age is also a risk factor because as the person ages, the arteries, they become very thick and the lumen also becomes small. On top of that, if there is collection of lipids out there, then the stroke can take place. And there are some genetic causes when the arteries are damaged from the birth because of genetic disorder. What are the clinical features of stroke? Because of that stroke, the cells in the brain cannot function because they are dead in a particular part of the brain, focal area of the brain, and because of which they develop paralysis of the one side of the body, that is called hemiplegia, paralysis of the face called facial palsy, slurring of speech, the speech is not clear, that is called dysarthria. They can have loss of memory, they can have vertigo or giddiness, and they can have vision impairment or loss on one side of the body. So what is this? This starts very suddenly, and they are caused by focal lesions of the brain, and they are persistent, maybe lifelong, and they are not easily recoverable, and they are because of vascular lesions in the brain, because of blocking of the artery. So first of all, we have to diagnose the ischemic stroke. You diagnose it clinically when you see hemiparesis, or you can see the other clinical features like dysarthria, facial palsy, and they have to start very suddenly. The patient is all right, and suddenly, like a bolt from the blue, the patient falls sick. And then you have to do a CT scan. On doing the CT scan, you can find out the area of the infarct, and you can also find out which blood vessel is blocked. And once you know it is because of a blocking of a blood vessel, you know it is a ischemic stroke. So you have to do a CT scan or MRI of the brain. Once you diagnose the stroke by clinically and by doing CT scan or MRI, and you know it is a sudden onset focal neurological deficit because of vascular cause and blocking of a blood vessel, then you have to start the treatment. So like all emergency patients, you will have to take care of ABC, airway breathing circulation. Our intention is to dissolve that blocking. Whatever is the block, to dissolve that block. How do we dissolve the block? We can do it by a medicine called RTPA, or tissue plasminogen activator. This will dissolve the blood clot, and the blood vessel will start, the blood can flow to the blood vessels and bring the oxygen and the glucose to the blood cells of the brain. But if it is too late, then it is no use because the damage is permanent. So we have to give this medication within 3 hours of the stroke. After that, the damage is permanent, and even stopping or dissolving the clot will make no help. We have to give medicines to prevent further formation of that clot in that place. So we give the antiplatelet drugs so that the platelet is not collected. Antiplatelet means to prevent collection of the platelets inside the blood vessel. So what medication? Like aspirin and clopidogrel. We also have to prevent the blood pressure from damaging the blood vessels. We have to give treatment for the lipids, for excess cholesterol and excess triglycerides and other lipids, so that the lipids don't collect. What are the main collecting factors? They are the lipids and the platelets. So to prevent the platelets from collecting, we are giving antiplatelet. And to prevent the lipid from collecting, we are giving anti-lipid drugs. We have to also tell the patient to control their diet, to have less amount of fat in the diet so that the lipid and cholesterol is under control. So diet control is also very important. Treatment of diabetes. The patient has to stop alcohol and smoking for lifetime, otherwise the stroke can occur. If any cardiac disease is out there, we have to treat for the cardiac disease, whether it is myocardial infarction or atrial fibrillation. Rehabilitation therapy like physiotherapy has to be done for the hemiplegia or the paralysis, and speech therapy for the dysarthria. Lifelong treatment is required because stroke is persistent problem. It is not going to recover fast. Hemorrhagic stroke is another second big category of stroke, and it is because of bleeding inside the brain, where the blood clot, as you know, is collecting inside the tissue or parenchyma of the brain. Here there is no blocking, but here there is rupture of the blood vessel, or bursting of the blood vessel inside the brain, causing the blood to come out and collect and causing a blood clot. So intracerebral hemorrhage is bleeding inside the brain parenchyma, and they occur because of the rupture of the arteries in the brain. Again, a vascular cause. What is the cause? Arteries. What happens to the arteries? Bursting of the arteries. And this blood clot will cause compression and destruction of the surrounding tissue. Okay, the blood is a little toxic material and irritating, and it is also causing pressure on the surrounding tissue and causing destruction. So what are the causes of hemorrhagic stroke? Uncontrolled severe hypertension. So blood pressure is so much that the thin blood vessels of the brain rupture. Alcohol also causes hemorrhagic stroke. Head injury or head trauma can cause hemorrhagic stroke, and rupture of a brain aneurysm. As I have told you, aneurysm is what? A balloon like outgrowth in the blood vessel. Again, blood vessel. And this balloon like outgrowth sometimes can rupture and cause oozing of blood and hemorrhagic stroke. And some drugs like anticoagulation drugs are blood thinners. They thin the blood. Okay. So they prevent coagulation, or they prevent the blood from coming together to form a clot. So sometimes when these anticoagulation drugs are given in excess dose or in high dose, they can cause bleeding. Not only inside the brain, they can cause bleeding from GIT, from epistaxis or hematemesis, hemoptysis, and also inside the brain they can lead to hemorrhagic stroke. So these drugs have to be given carefully and in controlled doses. So these are the causes of hemorrhagic stroke. Hypertension is a common cause in both ischemic as well as hemorrhagic strokes. So clinical features of hemorrhagic stroke, we have to remember that hemorrhagic stroke is more dangerous or more severe than ischemic stroke, and it can lead to death suddenly. Then the clinical features are because of the increased pressure inside the brain, because of this blood clot collecting, there will be headache, severe headache, vomiting, and convulsion, seizure, and hemiplegia, paralysis, and slurring of speech, that is dysarthria. So these are the features of hemorrhagic stroke. We have to do a CT scan, and in the CT scan, we are going to find out the blood clot in the CT scan. And once we diagnose hemorrhagic stroke by CT scan or MRI, most commonly CT scan of the brain, and then we can start the treatment. In the CT scan, the blood clot is going to be seen as a white patch. So in the hemorrhagic stroke, again, it is an emergency, so you have to control the ABC, the airway breathing circulation. In the medical management, control the blood pressure, so the blood pressure inside the brain is also increased, the intracranial pressure, and the blood doesn't come out more. And you have to reduce the intracranial pressure because this clot is causing lots of pressure inside the brain by giving medicines like mannitol. If the patient is taking any anticoagulant drugs which is causing the bleeding, we have to see the prescription and stop those drugs or adjust the dose immediately. In the surgical removal management, there is removal of the clot by craniotomy. Craniotomy means the skull. A hole is made in the skull using the instrument by a drill, and then the blood clot is sucked out by the surgical methods. Okay, so this is the removal of the clot by craniotomy. Craniotomy as a hole is made in the skull by a drill, and from that hole, the instruments are put inside. The clot is, we have to reach the clot, and after the clot has to be removed or sucked out by surgical means. So that is the removal of the clot by craniotomy in the case of hemorrhagic stroke. So these are the important points you have to remember in case of stroke. The types of stroke, the definition of stroke, the classification of stroke, and then the cause, the pathophysiology of stroke, and the clinical features. Management is not so important, but the other things have to be known. So please go through and tell me if any queries are there, if you want any clarification on any point. You have to remember the definitions very nicely, that it is a sudden onset phenomenon involving the brain, but not the whole of the brain, a focal area of the brain, and it is long duration. Lack of rapid resolution is not going to improve fast, and their cause is because of the blood vessel of the brain, mostly the arteries of the brain. In one case we have seen in the ischemic, the artery is blocked, And in the other case, hemorrhagic, we have seen the artery is bursting, ruptured. Okay? You have to know the two phenomena in ischemic stroke. How does it get blocked? By thrombosis and embolism. In thrombosis, it takes place in the blood vessels at that place in the brain, and in embolism, it is coming from a heart, from far away place, because of the irregular beating of the heart in atrial fibrillation. The risk factors are very important to remember because we can control stroke by treating these factors like hypertension, diabetes, smoking, high cholesterol, alcohol. All these have to be controlled by medicines and also by good lifestyle. They should have a low salt diet, low lipid diet, no fats, stop smoking, and control of diabetes. And alcohol should be stopped. You have to identify the symptoms very nicely when the patient comes, like paralysis, facial palsy, slurring of speech, then the medications that are going to be starting. Hemorrhagic has to be identified in a CT scan. It is very dangerous type of stroke because it can cause death suddenly because of the increased pressure inside the brain. So any clarification? We still have some time. If you have any questions, you can ask.
Sir, if in ischemic stroke, age is like old age is a cause and risk factor, then what about hemorrhagic stroke, sir?
No, in hemorrhagic, old age is not a risk factor. In ischemic, yes, old age is a risk factor because, as I said, the arteries, they become hard in the old age because of depositions inside the arteries, and there's more chances of blockage. But in hemorrhagic stroke, no, age is not a risk factor. It can take place at any age. Please remember the pathophysiology of both types of stroke, right? Especially of ischemic because it is more, the pathophysiology is more detailed, right? Thrombosis and embolism. In case of hemorrhagic, there's not much in the pathophysiology other than rupture of the arteries, okay? So you have to remember in the ischemic stroke, the pathophysiology nicely. Where the two types are out there, thrombosis and embolism. Okay, if no questions are out there, we'll end and we'll continue next Thursday. Okay?
Thank you, sir.
Thank you.